So first of all, Kristi, why did you decide to get on board this campaign?
I was asked to do this, and I suppose my grandparents died of cancer, and I just think it's a great thing to be involved with. Alcohol is probably a problem in our society these days, and also for the hospital here to try and raise some funds for the Oncology Award and really get people behind us.
I guess obviously playing a lot of sport, you do realise the importance of making sure you don't drink too much or having good drinking habits. Do you think more people in society could be doing similar things?
Yeah, I think so. I think, I suppose for me, I've never been really much of a drinker. I probably did have a drink after we won the WNBL Championship, but that's quite rare for me. I think, growing up being nearly a professional athlete for about 20 years, I've been so strict on my diet and what I do and all the training that I do. So it's really important for me not to drink, for me to be successful in what I do.
Jeez, and I suppose just maybe the last thing, just a message to the community, just when they are drinking, just think about how much they are consuming or something like that.
Yeah, I think people that do drink realise that who you're drinking in front of. If you're drinking in front of your young kids, you're actually a role model to those kids. And I think that drinking these days is a lot of binge drinking by the younger generation, and if we can try and get that under control and be a role model for the people that are around us, and that realise that drinking, whatever type of drink you do, there's a lot of calories and stuff involved. So if you want to try and be healthy, then I know I lived in France for 5 years, and of course they love their wine over there, but they might only have one glass of red at dinner or something like that, and that's enough. It's enough to, I suppose, satisfy you, but just try and be a role model to the people that are around you.
Okay, now Mark, I understand you're a patient here for some time, is that right?
Yes, I was. I was diagnosed with cancer back in October 2011, and so pretty well much for a fair period of 2012 I was a visitor up here as a patient, and in fact I'm still visiting here every 3 months to do some blood tests and talk with oncologists. So it's a wonderful facility, and I think that Dry July offers us a fantastic opportunity to give something back, because as a recipient of the services up there and knowing how wonderful they are and how what a great benefit they are to patients, we should be doing something back. So Dry July for me is an ability to raise some funds to support this wonderful Oncology Unit in Bendigo.
I suppose this might be a bit of an obvious question really, but what do you think your life would be like without this ward?
Well, it is a good question. I suppose living in Bendigo before this unit was originally set up, people had to travel long distances, and so you'd be down to Melbourne typically to receive some oncology services. So whilst I might have still got through that okay, there's no doubt about it, having to travel out of your own town, down the highway. And that's just Bendigo people, let alone the people that originally came from Mildura and Echuca and things like that had to travel massive distances to receive oncology treatment. To have this in Bendigo, me as being a local Bendigo person, is fantastic, because it really means a lot to patients receiving oncology services to be able to have a facility such as this in their hometown. And whilst this one's a little bit old and run down, and we are getting a new facility with the new Bendigo-based hospital, we need to raise some funds now to give this one a bit of a freshen up, so that not only the staff who work here, and they're wonderful staff, but also the patients visiting this area perhaps on a daily basis have somewhere a little bit prettier to come and visit on a daily basis. So it's a wonderful program.
So first of all, Karen, what's it like working on this ward? Do you get attached to the patients, do you find?
Yeah, it's very easy to get attached to the patients. They're here for us for quite a period of time, and the staff get to know the patients very intently. So they can sort of become part of their families in a way, and then these days with survivorship and ongoing programs and longer treatment regimes, we get to know patients for a lot longer. Yeah.
How crucial or important would the money raised from Dry July be to the ward?
Oh, it'd be fantastic. The conditions here are pretty run down, pretty old. I mean, we have got a new hospital looming. It'll be at least 3 years obviously before we can move over there, and we're building a new regional integrated cancer service. So all of our oncology services will be in one area, which is radiotherapy and chemotherapy. But in the meantime, we've got a long time, we've run out of space and it's pretty run down. So it'd be fantastic to get as much support as we can to improve the facilities here in the interim.